Welcome to MediByte. Today, we're diving into a topic that comes up a lot for expectant parents: uterine fibroids. What are they, really? And what could they mean for your pregnancy? Let's break it all down. Finding out you have fibroids, especially when you're thinking about starting a family or you're already pregnant, it can feel a little unsettling. But I want you to know it's an incredibly common situation, and just getting a handle on what's going on is the best first step you can take. I'm sure you've got questions spinning in your head, like, what are these things exactly? Are they going to affect my baby? Is this pregnancy going to be different? Don't worry, we are absolutely going to cover all of that, starting from square one. So, to really get a grip on this, let's build a solid foundation. Let's make sure we're all on the same page about what uterine fibroids actually are. Okay, see that first word on the slide? Non-cancerous? That is the most important word here. Fibroids are benign growths. Let me say that again. They are not cancer. They're just compact masses of muscle and fibrous tissue that grow in or on the wall of the uterus. Now take a look at these numbers. This is what's really wild, just how incredibly common fibroids are. By the time they're 50, up to 70% of white women and a staggering 80% of black women have them. And for a lot of people, they cause zero symptoms. You might not even know they're there. So if you've been diagnosed, trust me, you are in very, very good company. Fibroids can pop up in a few different spots, and as you can see here, where they grow, their location is really key. The ones that grow just under the inner lining, the submucosal ones, are the type most likely to have any kind of impact on a pregnancy. The others might be inside the wall or on the outside. This is exactly why your doctor cares just as much about where a fibroid is as how big it is. All right, so we've got the basics down. But what happens when you introduce a pregnancy into the mix? How does that change things? Well, we don't know the exact cause of fibroids, but we do know they seem to be fueled by the hormones estrogen and progesterone. And guess what your body is making in huge amounts during pregnancy? Yep, those exact two hormones. So that hormonal surge can sometimes act like fertilizer, causing fibroids to get bigger, especially in that first trimester. Now and then, a fibroid can grow so fast that it literally outgrows its own blood supply. This is something called degeneration. And while the word sounds a bit scary, it's not dangerous. But I'll be honest, it can be pretty painful. In fact, it's the #1 cause of fibroid-related pain during pregnancy. It usually feels like a sharp pain in your abdomen, and it's definitely something your doctor can help you manage. Okay, this is the section that, let's face it, most people are worried about: the risks. It's really important we talk about them, but it is just as important that we keep them in perspective. I wanted to put this quote up first because it comes straight from the source material, and it is the single most important message of this whole explainer. For the vast, vast majority of people, fibroids in pregnancy cause no problems at all. They're just quiet passengers along for the 9-month ride. Okay, so while most pregnancies are totally fine, it is true that in some cases, having fibroids may increase the risk for certain things. For example, a really big fibroid could get in the baby's way, making it hard for them to get into the head-down position for birth, or its location could potentially irritate the uterus and lead to preterm labor. Now, these are possibilities, not certainties. They're just potential risks that your healthcare team is well aware of and will be watching for. Knowing about those potential risks naturally leads to the big question: so what do we do about it? Let's talk about the game plan and what you can really expect. And here's the crucial thing. We very rarely do anything to actively treat fibroids during a pregnancy. Things like surgery are generally off the table because of the risks to the baby. So instead, the gold standard approach is simply careful observation, what we call a watch and wait strategy. And this monitoring isn't anything scary or out of the ordinary. It's done as part of your normal prenatal care. It's your doctor doing regular pelvic exams to check the size of your uterus, and it's using those routine ultrasounds to get a crystal clear picture of everything that's going on inside. This is exactly why ultrasound is such an amazing tool. We can literally track the fibroid size and pinpoint its location. We're looking to see if it's growing and checking if its location might interfere with the baby's positioning or how the placenta is working. It's all about staying one step ahead and being prepared. So let's bring it all home. Hearing you have fibroids during pregnancy can feel like a big deal, I get it. But remember the key points. They are super common, they are usually harmless, and the standard plan is simply to keep a watchful eye. The absolute best tool you have is a strong, open partnership with your healthcare provider. And that brings us to our final thought, which is maybe the most important one. Never, ever be afraid to ask questions. Share what you're worried about with your doctor.
So we'll leave you with this to think about. How can that open line of communication truly empower you to navigate your pregnancy journey with real confidence?
Hey, if you found this explainer helpful, please do us a favor and hit that like button, share it with someone you think could use it, and of course, subscribe to the MediByte channel. We are dedicated to bringing you more clear, reliable health info to help you feel empowered. Thanks so much for watching.